Pandemic, just to put us all in context, as always, there are a lot of cases going on in the whole world right now. We're up over 75 million cases, 1.6 million deaths. Almost every country is affected. And after a good run here in Australia the last few weeks, unfortunately we do have an outbreak, as people are aware, on the northern beaches of Sydney. A place I know well. I did a lot of my growing up there, so my heart goes out to the people of that area. And as we have heard just recently from the New South Wales Premier, there will be public health order restrictions from tonight for the next few days to try and get on top of that emerging outbreak. So there's been 23 new cases in that area over the last 24 hours to 8 p.m. last night. I would give a shout out to the community there in the Northern Beaches. You're turning up in huge numbers to get tested. That's absolutely what we need right now to find out how this virus has spread. And also to local businesses, even the Australian Hotels Association, who has worked with pubs and clubs in that area to make sure that people are safe, and most of those businesses have decided to close before this order. Also, churches, I understand, and of various denominations, and the Buddhist temple as well, have decided to restrict their services over the next few days. So we've all learnt together, and we're all in this together over the last few months. We know what needs to be done, and the New South Wales health authorities are doing exactly what's needed. They're using that rings of containment approach. So we've got the borders and quarantine being very strictly adhered to. We've got personal behaviours that are being reinforced about washing your hands, cough etiquette and so forth. Stay at home if you're sick. We've got test, trace and isolate happening in large numbers in that area in particular. And now that decision to move to more restrictions over the coming days, back to where Sydney was in March and not largely since then. So I really want to stress that anyone who has been in the Northern Beaches, wherever you are now, to consider, to look at the advice on the New South Wales Health website and make sure that if you have been in any of those venues, that you do get tested, whether you have symptoms or not. And those with even the most mild symptoms do get tested as soon as possible. This is how we'll know whether the virus has spread outside of that LGA. It's also a call out to all Australians, but particularly those in Sydney, to download the COVID Safe app if you haven't already done so. Many millions of Australians have done so, and make sure it's turned on. We've made improvements over the last few months in relation to the app. This is exactly the situation where the app will come into its own. But it will only come into its own if people have the app installed on their mobile devices and switched on. So please do that. That will really assist our disease detectives in the coming days. In terms of Commonwealth assistance, we are reaching out. I'm having several times a day having discussions with Dr. Kerry Chant, the Chief Health Officer in New South Wales, to discuss the situation, to give advice, and to hear from her personally what is happening and her thoughts on the matter. The AHPPC is meeting every day again. I'll be going to a meeting straight after this so we can discuss this matter with all states and territories, who are all making their own decisions in relation to their border arrangements. We've particularly, after yesterday declaring the LGA of Northern Beach as a hotspot, have put in place all of the supports that we can and should be giving to aged care facilities in that area. As we know, there is one retirement village with an aged care facility beside it at Japara in Bayview, which has had 2 cases in the retirement village, as well as one of the staff. And so we are really giving great assistance to that place. We're putting in our private testing arrangements for that particular facility, so we can make sure that there is no spread there. And there are other arrangements that have been made around PPE and the like in relation to that. Commonwealth staff have joined the New South Wales State Health Emergency Operations Centre and are assisting particularly around aged care matters. So look, this is concerning, of course, and in the lead up to Christmas we were hoping that we had been going so well, and we are still going so well elsewhere in the country. No reported locally acquired cases today, but it's a concern. We have New South Wales Health, with assistance of others, right on the ground there and doing everything they need to do, and I have full faith in them. They are the experts on testing, tracing, and isolation efforts in Australia, and we'll be watching closely in the coming days to see what happens and what the effect of these new restrictions might be overnight in terms of decreasing the cases.